Beauty to me means being the best version of yourself, inside and outside, you know? And so you're embodying the things that make you you. So we all have our own flaws, and some of those flaws is also what makes us, special or really good at what we do, right?
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Sumeet Jindal, a board-certified surgeon specializing in eye, eyelid, and facial cosmetic surgery. His practices, Gia Facial Cosmetic Surgery and New Century Ophthalmology, provide the latest technology and precision surgical techniques. And by doing so, not only offer the best treatments in Raleigh, North Carolina, but attract patients from all over the US and even overseas. Dr. Jindal's specialties in eyelid cosmetic surgery, which is blepharoplasty, endoscopic lifts, deep plane facelifts, and more allow him to get patients the best results and repair numerous botched procedures done from other surgeons every week. So Dr. Jindal, welcome and glad to have you here.
Yes, glad to be here. Glad to be here.
Yeah, so let's start at the very top. What got you first interested in the medical field?
Yeah, so medical field, I mean, I was kind of born into it. You know, our whole family has a bunch of doctors in it, kind of follows the whole Indian stereotype, and so my dad has a lot of brothers, so a lot of my uncles were doctors, their kids went into medicine. I always just assumed that I was going to be like my dad when I grew up. So my dad's also an ophthalmologist. He's an eye surgeon. So I kind of, just went about thinking that's what I was going to do. I got into this program, one of these early assurance programs that gets you a guaranteed spot in medical school out of high school. So I think college is when a lot of people pivot to rethinking their career choices. And I think because I was already in a medical school, I didn't even have to think about it. I was like, yeah, that's what I'm going to do. I'm already in a medical school. And then it just kind of went from there. But I guess I didn't, I knew I wanted to help people. I knew I wanted to do stuff with my hands. But I didn't really realize how much I loved what I did or what I get to do now till I started my surgical training in ophthalmology and then in oculofacial surgery. So that's when I was like, oh, okay, like I made the right choice. Like this is what I want to be doing.
Okay.
Until then, I think you were just kind of, getting the grades, working hard, doing the thing, but you don't really know till you know.
Yeah. And do you think it was because of your father was in the field of ophthalmology that's where you got into, or was something else that kind of caused you to choose ophthalmology to specialize in?
Yeah, I think, I mean, it definitely, I'm sure a large part of it was the fact that he's an ophthalmologist, because ophthalmology is such a niche field. Unless you're like exposed to it early on, it's hard to, you don't get a ton of exposure to it in medical school itself. So, but I knew there was a lot of medicine as well as surgery in it. I knew it was a lot of outpatient. You don't have to like live your life at the hospital. And there's a lot of technology in ophthalmology, which I always really like technology and lasers and high tech stuff. So, and then ophthalmology as a field is so multifaceted. I mean, to think that on one day I'm doing, surgery down to the micrometer in someone's eye, and then the next day I'm doing like, some fancy eyelid surgery, cosmetic eyelid surgery. It just shows how vast the field is. And so I really enjoy getting to do it.
Okay. And for your practice, Gia, eyelid, and facial cosmetic surgery, what led you to decide to start your own practice?
Yeah, so I'm kind of in the dual approach. So after I did my residency training, then I did my fellowship training in the oculoplastics and facial cosmetic surgery. And then I came back home to North Carolina. So I joined my dad. We opened a second location to our ophthalmology practice. And that practice, again, does a big mix of a lot of obviously insurance-based eye care, functional eye care. We're already doing oculoplastic surgery in that practice. And then we were serving very large underserved communities of patients who did not have good access to care. So we did a lot. We created low, affordable rates for uninsured patients so that they could get things like cataract surgery done and be able to see their grandkids again, or and so that was a big part of our practice, and actually still a very big part of what we do and a growing part of our practice. And but then within the same kind of building where we have our operating rooms, we opened our cosmetic surgery practice so that we can kind of tailor that part of the practice to those types of patients who are coming in looking for essentially the best of the best when it comes to purely cosmetic surgery of the eyelids and the face. And we wanted to create a center around that. So I'd say we get some of the benefits of being affiliated with our ophthalmology practice, but we're also a whole separate practice that has separate staffs, other separate providers, and just a different way of doing things in a lot of ways.
Got it. Okay. Now, I want to dive a little bit deeper into the treatments that you provide. I know you provide a lot of different types of treatments, but let's start off with blepharoplasty, which is eyelid surgery. So, in what situations would someone want to come to you to get blepharoplasty done? Is it kind of more from a cosmetic or from a functional or even both?
Yeah, I mean, the answer, blepharoplasty is something that kind of ticks all the boxes. I say it helps you, our clinic's motto is helping you look better, see better, and feel better so you can live our best. And blepharoplasty as a procedure kind of encompasses that, especially upper blepharoplasty. So, upper blepharoplasty, which some people will call like an upper eyelid lift, is where we're removing extra skin from the upper eyelid and a lot of times treating something called ptosis, where you have like weakness of the muscle of the upper eyelid. That'll actually make the eyelid sit lower and cover some of your eye. And then there's some fancy little things like if you have a little bit of extra fat, or if you have some, muscle contouring that needs to be done. Those are all like little nuances we do as part of that procedure. So we see patients who literally just want to look better. They say, "Oh, this extra skin here is bothering me," or "this little fat pooch," or "this my eyes look sleepy. I feel like I look sleepy or tired all the time." Um, and then we have patients who literally are like, "I have headaches because I'm lifting my brows up all the time to see better, and I can't get enough light into my eye." So we see them on both sides of the fence.
Interesting.
Yeah, yeah.
Okay. Now,
With and
yeah.
then oh, sorry about
No,
that.
please go
I
ahead.
was I was gonna, and then what also is part of blepharoplasty is lower blepharoplasty, which is lower eyelid surgery. And now that is more of a purely cosmetic thing, where usually the biggest complaint is I have bags under my eyes. And patients say, like, people ask me if I'm tired all the time or I haven't slept, and my eyes are just always puffy. And that's where we're actually contouring that fat, sometimes tightening some skin and muscle, and doing, again, lots of different ways to do it, but that's kind of the main gist of a lower blepharoplasty.
Okay. Now, another type of treatment you do is ponytail lifts. Could you explain what this is? I've never heard of a ponytail lift before.
Yeah, yeah, and actually, we don't call it a ponytail lift because that's trademarked by another
Okay.
surgeon who is kind of the master of that lift and has luckily he's published the technique and a lot of people have learned from it. But what the technical term for the ponytail lift or ponytail style lift, is an endoscopic brow and mid face lift. So mid face means this cheek, this upper part of your face, and then brow, we're usually picking up that kind of lateral part of the brow here. And we're doing all of that through a hidden incision in the hair. So through the small hidden incision, you can come in and get this whole part of your face up. And so this is a really popular procedure, especially for younger patients, but even we combine it with bigger procedures for older patients, uh, not only for facial rejuvenation, which is to help you reverse time and look younger, but we say facial beautification, where we're actually giving your face a more heart-shaped look, bringing this volume back up here and getting that essentially that sort of snatched-ish look that everyone's looking for.
Mm.
Um, Now, there are more extreme versions of this procedure that a lot of patients will fly to countries like Turkey for. Those are those fox eye or cat eye procedures you hear about.
Mhm.
And those surgeons will not only do this, but they'll actually cut a little tendon here on your eyelid so they can give you a really sharp, like, fox cat eye look here as part
Interesting.
of that procedure. we don't really like to do things that make people look too unnatural in our
Yeah.
clinic. We want once you're healed, no one should look at you and be like, "Oh, she got something done. Like she looks
Mm.
crazy." Um, we want more so people be jealous that, oh, she wakes up looking like this every day, and
Mm.
that's
Okay. Okay. Now, when it comes to these treatments, like what are some of the most common misconceptions people have about these treatments? Like the things that when people come in and you explain this to them and like, oh, I didn't know this about this treatment, or oh man, like I didn't know that that was a thing. Like, what are some of those common misconceptions?
yeah. I mean, I'd say probably one of the biggest ones is everyone's very concerned that as a surgeon I'm going to want to change the way they look as a person, or that I'm going to want them to look stretched or pulled or tight. And for me, I say no, my goal is to get people very natural results. We want you to keep looking like you, just refreshed and rejuvenated. Now there are types of surgeries and surgeons who specialize in doing procedures where you're actually purposely changing the way you look, for example, getting a rhinoplasty, right? Sometimes you're really changing your nose and it's not, say, your ethnicity's nose anymore. Like that's very transformative. Or that's, there's surgeons who specialize in facial feminization, where if a male is transitioning to a female, they're making the features more feminine. And for us, we're more so just taking what's you and either slightly enhancing it, which is the beautification side of it, or rejuvenating it, which is putting it back to where it used to be, or a little bit of both.
Mhm.
Um, and so I say, but that's one of the biggest misconceptions is that people feel like, oh, I still want to look like myself, and they're worried that we're going to change that.
Got it. Okay. Now, let's say that somebody is looking to get this treatment done or this procedure done, but they don't know which provider to go to. They don't know who to choose. What would you say is the most important piece of advice you would give to this person so that they can find that provider that has the knowledge, has the experience, and can get them the result they're looking for in the end?
Yeah, definitely. So there's a few different disciplines of surgery that can specialize in cosmetic procedures. The biggest branch of this field that does is plastic surgery. So you can't go wrong finding a surgeon who's certified by the American Board of Plastic Surgery. And then you also have surgeons who are ENT trained that then do a fellowship in facial plastic surgery. Um, and which again, especially the focus purely on the face. You have ophthalmologists who do fellowships in oculofacial or oculoplastic surgery. And then you even have oral maxillofacial surgeons who specialize in facial cosmetic surgery. So essentially, you want a surgeon who has done a lot of training in surgery, even if that's functional surgery, and then has also done fellowship training in that specific field. And once you know that they have those credentials, then you need to look at their website, their social media, their look at their references, and find people whose work you like their results. Um, they have good reviews, and then you just go on a bunch of consults, right? Like I tell patients too, like they're like scared of offending me. And they're like, I'm going to go to some other consults after you, and I'm like, yeah, you should, because like this is when you're having surgery, it's not just about the day of surgery, it's about the whole healing process afterwards, right? And you need to choose someone that you're comfortable with for this entire healing period, and knowing that things can go wrong. Healing can be unpredictable, things can go wrong in surgery. You might need little tweaks afterwards. And did you choose someone that you trust enough to go through the goods and the bads with, right? It's like a marriage,
Mhm.
essentially. So you need to um, choose wisely. Again, you need to like the results, and then the next step is that surgeon's personality, their staff, how the office treats you. That's the next most important thing.
Okay. And you bring up this interesting point as far as when it comes to the dichotomy, like if someone's looking for a provider and on one end they find a provider that they really like, they really connect, they really jive with, and they find another provider that has a lot more experience, ability, knowledge, which side would you put more weight on? Now I know in an ideal world you have one where they're really good and you also really like them, but
Yeah, yeah, yeah.
kind of if you have to kind of look at one or the other, which would you probably put a little bit more credence behind?
Yeah, I mean that's a tough question, because like I think if, my wife or my mom needed something done,
Mm,
am I going to care more about, hey, this is the most skilled surgeon,
mm,
or is this the nicest surgeon? And I
mhm,
mean, part of me is like, okay, I don't care if he's kind of an asshole. Like, I want her to have the most skilled person possible, the most skilled team in the skilled office.
mhm,
But at the same time, then you get worried. Well, if something goes wrong, is this surgeon going to actually help, or he doesn't care,
mhm,
or does he feel above it, or she? Um, so yeah, I mean, I would try to find the best blend of both, but
mm.
I mean, I mean, if you find I think, I'm like battling with myself right now.
It's not an
I
easy
think,
one.
yeah, I mean, if if the nice surgeon has a good track record of results,
Mhm,
I think for the most part, I mean, even a mean surgeon, like everyone wants the best for their patients at the end of the day. Sure, are there some bad actors out there? 100%. But for the most part, everyone kind of wants their patients to get the best results possible. And so the nice surgeon maybe hasn't been practicing for 30 years like the other surgeon has, but if he's had good training, he's going to get you there, one way or another. And that might even mean passing you off to another surgeon that he trusts to help with things. Um, but yeah, no, I kind of that's a long-winded way of me saying I don't know.
Well, it's not an easy question to answer. So now, Dr. Jindal, when it comes to creativity, what role do you believe creativity plays in how you approach patient care?
Yeah, so I think in terms of surgical decision making, it is important to be creative in the sense that if something goes wrong, you can't just throw your hands up and being like, okay, well, these aren't planned. Like this whole thing's a failure, right? You need to have a plan A, a plan C. It's very like military like. They say like two is one and one is none, and we always have to have backups ready. Always be ready for the worst case scenario.
Mhm,
But for at least the types of procedures that I'm doing, which is mostly facial rejuvenation and looking for a very natural look, a lot of patients say, "Oh, I want my surgeon to be an artist, right? And use your artistry to make these decisions and whatnot." And I say, I don't want artistic because if I'm being artistic with your face, that means that I'm visualizing a result in my mind that may not be the same thing that you're visualizing, right? And
mhm,
now I'm creating that result. So I prefer to think of things very anatomically. I'm like, if I follow your anatomy, if I release things properly, and I put things back to where they used to be, then I don't really have to use much artistic judgment. It's almost more anatomical and scientific judgment. That is one, going to keep you safer. Two, probably get you the best result. And three, get you the most natural result. Because we're not doing unnatural things to your anatomy to be like, oh, well, I think cheeks look better if they're here. So I'm going to pull them a little extra tighter. Or I think that this looks better here. And I'm going to put it here. Um, it's just put things back to where they used to be, where your body wants them to be. Um, Now, that kind of changes a bit if someone's had a procedure that did not go well. If it's a revision procedure from another cosmetic procedure, or if we're doing a reconstruction, someone had skin cancer and now there's a big hole in their face and we need to put it back together. That's where now the anatomy is not in its natural position anymore. And you have to get creative with, how do I recreate this? How do I get this person looking more like themselves again? And I
mhm.
think that's where more of that creativity, that artistry comes into play.
Okay, well said. Now, I'm sure that throughout your experience, you've had some memorable cases or even challenging cases you worked on. Is there maybe one story that comes to mind that you can share of one of those memorable cases, one of those maybe challenging cases, and how you were able to get them a successful outcome in the end?
Yeah, I mean, I would say, and I've had a good amount of these cases just because it's something I specialize in. But one thing we unfortunately, commonly see is something called lower eyelid retraction. And that is when the lower eyelid has pulled down and has been pulled down from an overaggressive lower blepharoplasty. So patients going for lower blepharoplasty, they want their eye bags taken care of, they want the wrinkles gone from their lower eyelids. And But if you pull this too tight, the lower eyelid is one of the most sensitive parts on the face. The lower lid will pull down. And getting it back up to its normal position is actually really quite difficult. It requires a lot of steps. It's This anatomy here is so thin and fragile. All these layers will kind of scar together, and you have to get them apart. And this doesn't just like look bad in the sense that because a millimeter on your eyelids can really change someone's appearance, right? So their lower lids pull down. One, the patient feels like they don't look like themselves anymore. Two, they feel like they look bad. So it's not just that they don't look like themselves, they just feel like I look bad because of this. Three, they can't fully close their eyelids anymore because the lower lid is pulled down. So now their eye is drying out all the time, and this is affecting their vision. So now their vision is chronically blurry. They're constantly uncomfortable. They almost become a chronic pain patient in these scenarios.
Mm-hmm.
So when we, I mean, I've seen some patients who've gone to some top name surgeons in Beverly Hills and New York City and Turkey and stuff like that who've had this happen. And then we have to figure out how can I safely get this lower eyelid back into position, not only to make this patient feel like themselves again, to make them look better, but also to restore the function and health of their eye because their eye is drying out, because their vision's chronically blurred, and we have to restore all of those things. And again, it's a big procedure. It's a multi-step procedure to do it, and it kind of varies a little bit for everyone.
Wow. Okay. Sounds complicated.
Yeah, yeah,
Okay.
yeah, but more common than you think, and it's not something that a lot of surgeons really specialize in or really want to do because it's a tough case, and sometimes I tell patients going into it, like, hey, this might take me 2 or 3 procedures to get you to the right spot.
Mm-hmm.
I don't want it to take 3 procedures. I want to fix it one time and it'd be good to go. But we have to be mentally prepared for it
Mm-hmm.
because uh, healing can already be unpredictable. But once you're going back in to a case that did not heal well, healing is definitely very unpredictable.
Okay. Okay. Good to know then. Now, Dr. Jindal, where do you think the future of this field is going? Like, do you think there's any kind of like really new changes on the horizon? Like, or where do you think it's going to go?
Yeah, I mean, I think the trends in uh, cosmetic surgery uh, are now trending more towards, at least right now, more towards a more natural look.
Mhm.
I think a few years ago, med spas were booming. People were getting a lot of filler in their faces, and now people were started catching on. They're like, "Hey, I'm getting, an extra syringe in my face every year, and I'm slowly not looking like myself anymore." And so there's a huge shift now where everyone's like getting all their filler dissolved and going for more regenerative treatments, or even going to surgery earlier on because they want a more natural, long-lasting change.
Mhm.
So in the non-surgical world, like regenerative medicine's now like booming, regenerative and wellness, using biostimulators to build collagen in the skin, obviously continuing to use lasers and stuff. Peptides are getting very popular mainstream, whereas 10, 15 years ago it was like only the biohackers using it, and now like well, of course everyone's on Ozempic now, but I'm talking peptides like
Mhm.
BPC 157 and TB 500 and all these things. And so that's kind of where it's headed. And it's just continuing to be more of a, not just an aesthetic thing, but a lifestyle and wellness sort of field.
Mhm. Okay. Okay. So interesting. I think it sounds like the future is gonna be hopefully bright.
Yes. Yeah. 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 Hopefully,
Okay.
but I mean, I think when anything gets commoditized,
Mm.
you know,
Mhm.
it's, like, does everyone need to be on testosterone? Like, maybe not. Does everyone need to be on Ozempic? Maybe not. And it
Mhm.
starts getting, people are popping that stuff like candy now, but it's, it's definitely a shift overall.
Okay. Well, Dr. Jinjal, I do have one last question for you, but before I ask it, I do want to point people to your website at giacosmetic.com. Now, last question for you. What does beauty mean to you?
Beauty to me means being the best version of yourself, inside and outside, And so you're embodying the things that make you you. So we all have our own flaws, and some of those flaws is also what makes us, special or really good at what we do, right? So if someone's like super ADD, that might not make them great to like have a conversation with, but those people can be very successful at other areas of life. If someone has if someone's addicted to, their phone, or addicted to creating things or being very creative, but doesn't have the ability to, uh, you know, socialize well with other people, that again doesn't bode well for them in some areas of their life, but they can be very successful in other areas of their lives and still help a lot of people, right? So I think that's what like true beauty is. It's like knowing what your flaws are, knowing what your strengths are, and really like leaning into them to maximize how you can like contribute to everyone around you.
Okay, well said. Well, there you have it, Dr. Jindal sharing his expertise. So, Doctor, where can people contact you and your practice?
Yeah, so I think the easiest ways, again, if you go to our website, which is giacosmetic.com, that's JIYA, named after my daughter, or our Instagram, which is at Gia Raleigh, Raleigh. I think I spelled that right. That's probably the easiest ways to get a hold of us. We do a lot of virtual consultations. I'd say probably, uh, you know, almost half of our patients come from out of town and fly in. And luckily, our clinic's right by the airport, so that makes it easy. And yeah, we'd love to see if we can help in any way, whether it's to help you see better, look better, or feel better.
Awesome. Well, Dr. Jindal, this is awesome. Thank you for coming on, and thank you for sharing your knowledge and expertise.
Of course. Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.